Hello, everyone. This is Asif from Aptica Medicine. Today we will learn how to insert a cannula. It's a demo video only. First look at the parts of cannula. In this picture, have closer look on it, and remember these parts by heart. As you can see, we have a lot of cannulas here. Now how do we know which cannula is of which gauge? Which is written below our backside of packing of cannula. Such as it is of 24 gauge and how much will its flow rate be 22 mm per minute. Similarly it is written behind the rest of the cannula. As it says 22 gauge on the back, it's a 24 gauge, it's a 22, so it's a 20 gauge cannula. Finally, now we will see how to insert the cannula in the patient's vein. Let's see. We have a patient. First, we will see the superficial veins of the patient. A tourniquet will be tied before this. After tying, the patient will be asked to close and open his hand a little so that his veins become superficial. Now after that you have a spirit swab to clean the injection site. Why are we cleaning it? So that it is well sterilized and whatever bacteria is on the surface is killed. Now we will insert the cannula into the vein at a 15-degree angle. If there is blood in the cannula, it means that our cannula has been properly inserted. After that, we will remove the needle and leave the catheter in the patient's vein for intravenous infusion. After removing the needle, close the cap of the cannula as follows. After capping the cannula, we will fix the cannula well, and for fixing we will use micropore, so that your cannula doesn't move around. In this way we insert the cannula properly. Now we will see how the cannula is removed. Suppose a patient comes to you to have a cannula removed. How would you remove his cannula? So let's see. First you will remove the micropore. Remove the micropore carefully so as not to move the cannula and cause discomfort to the patient. After removing the micropore, place the cotton bud over the cannula insertion site, and gently pull the cannula out. And then put the micropore on top of the cotton bud, so that the blood does not come out from the insertion point. So see, in this video I have told you how to insert the cannula and how to remove it. So if you like the video, then subscribe the channel for further updates.